My name is Dr. Hillel Mazansky. I'm coming to you from La Jolla, California today, specializing in medical hypnosis, guided imagery, nutrition, and exercise. Today's health tip is entitled Chronic Pain. What is the cause? More than 100 million Americans suffer from chronic pain. When does the pain become chronic? The definition states that if the pain is ongoing for 3 months or more, that is defined as chronic pain. There is a multitude of causes of this chronic pain, just to name a few: fibromyalgia, irritable bowel syndrome, migraine headaches, persistent neck and back pain, menstrual cramps, and more. If one develops chronic pain of a long nature over 3 months, it is advisable that you see your local healthcare provider so that she/he can check in and find out what the cause is and determine what type of treatment is necessary. When one has chronic pain, unfortunately, depression ensues, and then a vicious cycle develops. The more you are depressed, the worse the pain is. The worse the pain is, the more you get depressed. So that cycle has to be broken in order to help heal. Psychological attitude to pain is also important. Some people can tolerate chronic pain without much of a problem, while others feel pain at the slightest problem. Now, this does not mean that those who feel pain frequently, there's something wrong with them. It's just that their pain level is increased so that they will feel pain more frequently. The general treatment for chronic pain is you go to your doctor and they give you narcotics and sleeping pills, because chronic pain interrupts sleep, and when you can't sleep properly, your pain is aggravated the next morning. The problem with using these narcotics is they are all across the board. They all have side effects, and dependence develops, which is addiction. And then these patients go from one doctor to the next, called doctor shopping, to try and increase and change their medication to a more powerful one. Oxycodone, Percodan, all these, that's the morphine, that's in the class thereof. So before this happens, it is better to treat yourself holistically, as far as I'm concerned. My number one treatment, obviously, is hypnosis. Studies have showed that hypnosis empowers patients with chronic pain to heal themselves. Other methods are yoga, acupuncture, and sometimes one has to go through to visit a pain specialist, and he or she may start off with cortisone shots, or if it's a chronic back pain, using radio frequency ablation, which is a freezing of the tiny nerves. Every chronic pain patient that I see has got psychological issues and are really feeling down. So what can you as the individual pain sufferer do to heal yourself? As I mentioned, the other two facilities. But you can use hypnosis. And on drmedicalhypnosis.com, is a video specifically for chronic pain. And friends, I have seen how this works. It is a holistic treatment and it works well. Some people feel yoga helps, other people feel that acupuncture works. That's fine. Whatever method you can come up with to empower yourself to treat your chronic pain, the better. The problem is that this chronic pain doesn't only affect the sufferer, it affects his or her family and relatives, etc., especially their partners. Do walking. Exercise with walking has shown to be highly beneficial because endorphins are released from the brain, and endorphins is your natural painkiller. We've also found that resistance training, working with weights or using a rubber band, that is extremely beneficial for muscle strengthening and muscle stretching exercises. There is not one covers all in treatment. One has to start off as a holistic physician, I say, with holistic treatments, of which hypnosis is one of them, yoga, and acupuncture. That's all fine. Try with that, because hypnosis, like all the rest, are free of any side effects and are non-toxic. Leave it not only to your doctors to treat your pain. Empower yourself to treat the pain yourself. We found that mingling with company, reading books, crossword puzzles, or anything that takes your mind off the pain is also an adjuvant to help treat your pain. This can be very distressing indeed, because the allopathic physicians, they just keep on increasing the dose of the narcotics and the patients become addicted. How now? Would it not be better for you to try a holistic method of treatment rather than taking medicine? In my food and chronic pain, in migraine sufferers, there are special foods that one does not eat because they are the triggers, and that causes the migraine headaches. For the irritable bowel syndrome, again, exercise, nutrition, and hypnosis. The same as with fibromyalgia. We have seen so many fibromyalgia patients who have been treated by their physicians and given medication that just gives them side effects. And when they come to us, we spend time and explain the condition, and then at the end of the consultation, we do the hypnotherapy. But you don't have to be here in my office for the hypnotherapy. If you go on drmedicalhypnosis.com, you will find treatment of chronic pain reduction. I can say a lot more, but due to time constraints, I have given you the most important points of managing your depression, managing your chronic pain. Depression also responds to hypnosis. Stress responds to hypnosis. There are many different varieties of illnesses and conditions that respond. Why shall you not be one of them? Empower yourself to treat yourself. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.